Hello, my name is Michael Collins. I'm a professor at the University of Wisconsin-Madison and a specialist in UW-Extension Cooperative Extension Family Living Programs. Today I'm here with Caroline Gomez, a health outreach specialist covering kids and families at UW-Madison. We're going to discuss the consumer financial implications of the Affordable Care Act, or ACA, that are going into effect in the next year. The Affordable Care Act, or ACA, has a large number of features impacting families, small businesses, communities, and individual consumers. Today we will focus on the impacts on families, especially related to budgeting, taxes, and other financial management tasks that people may need to plan ahead. Thank you, Caroline, for joining us today.
Thank you for having me.
Let's start with some basics about the ACA. In 2014, the ACA opens up a new marketplace for consumers to get health insurance. They're not currently covered by, if they're not currently covered by Medicare, employer. When will we start to see new insurance options being offered?
That's a great question. So when actually talking about the marketplace, this is going to be an online web portal for people to actually access health coverage. And so this will be housed on healthcare.gov. Because in Wisconsin we're having a federally facilitated marketplace, which means the federal government is going to be managing the system. And so people will be able to go, starting in October 1st of 2013, go on to healthcare.gov and actually see the different plans that they will be eligible for. And that's where they fill out their application, figure out if they're eligible for tax credits, which I think we'll talk about a little later, but then also pick and compare the different health plans that are available to them.
So October of 2013, so that's coming up right away?
Yeah, and that's when they can sign up. Coverage won't start though until January 1st.
Right, so they're signing up for coverage starting in January?
Yes.
Okay. And what's the website again?
Healthcare.gov, and I think I'll say it a couple times
Healthcare.gov.
this interview.
So if somebody has insurance now through their workplace, should they expect to see any changes in their premiums or their coverage next year?
So that's actually one of the questions that obviously is a hot button issue. It's a really important piece in terms of affording health coverage. But at this time, I would say we're not quite sure. In terms of the health plans that will be available through the marketplace, we're just waiting to find out who those qualified health plans will be officially and what kind of premiums and prices they're going to be charging. And that'll be in September that we find out that list of approved contracts through the Centers for Medicare and Medicaid Services, CMS. And then I would imagine that would then kind of figure the then premiums for the employer-sponsored health plans, because they have to also cover those essential health benefits. And depending on the programs that were available beforehand, there might be some flux. Whether it's lower or greater, we're not sure yet.
Okay. So the main thing is, even if I'm covered through my employer now, I probably need to pay attention come October about changes that might be taking place in the market.
Absolutely. I would say this is the time to start kind of looking into that and kind of getting familiar with your current plan and see how things might change going forward.
Right, okay. Now, if we start thinking about the self-employed or the uninsured, people who maybe don't have coverage right now, or their employer may not be offering coverage in the future,
Sure.
How should they begin to plan ahead, particularly for budgeting for healthcare costs?
Absolutely. So if you're self-employed or uninsured, you'll be able to access coverage through the marketplace now, which wasn't an option before. Additionally, depending on your income level, you might also be eligible for the Badger Care Plus program, which is Wisconsin's Medicaid program, and that we can kind of get into in terms of income levels. But there's going to be options, I feel, for people that might not have had options before. But some resources that they'll be able to go into is actually healthcare.gov. Right now, since it's not open as the marketplace itself, there's actually some pretty useful consumer materials where you can kind of read about the different groups of people that will be covered in different ways. There's also a nice tool where you can answer a couple questions and they kind of give you an estimate of what you might be eligible for starting October 1st. And then I want to also address the Kaiser Family Foundation website. They actually have a tax subsidy calculator where you're able to plug in your family's information, who would be seeking health coverage, and then you would be able to see kind of an estimate of what a premium around your family's income might look like, and what type of federal tax credit subsidy you would be eligible for, approximately. So just a way of thinking about it going forward.
Great, so it sounds like that for people who've maybe not been insured before but have had that nagging feeling they should be covered, or maybe who aren't real happy with their coverage, should definitely begin to shop around. So this sounds like a time when they can start to think about maybe getting that coverage they didn't have or getting better coverage than before.
Absolutely, and even if they know for sure that that Marketplace is going to be their option, you can go online and actually sign up with a username and password already. So, and that'll actually give you email notifications if there's some updates.
When plans start to come out.
Exactly.
Right, okay. So you said that the Kaiser Foundation has a website where I can look at how much maybe a premium might cost me for my situation.
Yep.
Do you have any general sense of what this is going to cost in terms of family budgeting, or?
Off the top of my head, not quite. I believe they said that the average family would have at least a tax credit subsidy, an average of $2,700 a year.
Okay.
And so, and that's just very loosely average family, average annual tax credit subsidy. But that's one of the quotes that I heard swirling around.
So the main thing for families who are trying to think about how to budget for this next year, maybe to go to the Kaiser website, to plug in their specific information, and then to get a sense of how much.
Absolutely. I mean, I think any tools right now that kind of help them guesstimate going forward at least is something, because all this information has been so, iffy and late coming as this is getting closer and closer.
So what are the factors that help us determine how much our premiums are going to be? It's our family size and our income. Are those the big drivers?
So family size, income, where you live, that's going to be one of the factors. And then a new one is whether or not you smoke.
Okay.
And that's actually another component of the application itself on healthcare.gov.
So a larger family, sort of middle income with a smoker, is going to pay more than a smaller family with no smokers and maybe lower
Potentially,
income.
yeah.
Yeah. Okay. All right, that's helpful. And it sounds like because there's all these different measures, it's going to be important for people to do their homework.
Sure.
And to try to understand what they're going to be looking at.
Yeah.
So you talked about the federal income tax portion of the way that the premium supports are going to happen. What is that all about? I think for a lot of people, they think about their taxes as being something they do every April, and maybe they get a tax refund for child care or for earned income or something like that.
Sure.
But now we're introducing something new here. What is that all about?
So, and it's a couple of things. So this premium tax credit subsidy, and a lot of those words are kind of interchangeable and when you hear them. This is meant to be a way of helping families who had access to coverage or maybe didn't have access to coverage, help pay for those premiums. And so that's kind of one of the pieces. And so when you're going into the marketplace as someone who's uninsured or someone who's just never had access to affordable coverage, you'll be able to put in your family's income and figure out how much assistance from the federal government you might be able to get. And this is apart obviously from our Medicaid program where people who are very low income will have access to coverage, but this is something more towards the middle class where families that had to pay out of pocket or what have you will now get some assistance to pay those monthly premiums. And the way that works is you fill out the application, you find out what type of assistance you will be eligible for, and then you get to elect if you want to send that right away to the insurer of your choice, whatever plan you end up choosing, or if you want to hold your allocated tax credit till when you file taxes, and then actually you claim that at that point.
So I get a bigger refund check. Basically.
Exactly.
Right.
So they'll have that option.
Huh.
Do I want it to go to my monthly premium so that instead of, let's say, $500, I'm paying $300 a month? Or is it something that I'm going to wait till the end, pay whatever I have to pay throughout the year, and then get the bigger tax return?
Right. So the way to the end, probably people are used to getting a refund. So,
sure.
But this monthly premium basically gets, a portion of your refund gets paid in advance directly to the insurance company.
Yep. And so that's something that they'll be able to elect. Additionally, there are additional cost-sharing discounts where depending on your family's income, and I believe the cutoff is 250% of the federal poverty level, they would be able to get additional discounts on co-insurance, deductibles, those kind of out-of-pocket costs.
Okay. So are families going to need to be prepared for tax? How would I get ready for my next tax season? Do I need to track every medical expense, or how do I get ready for this?
They're putting out some of those rules in terms of what they're going to be expecting in terms of identifying people's coverage, but it sounds like it's going to be more of a item for the insurer themselves to give you, the consumer, the material to prove that you've had coverage. Because the way that they're going to assess the individual mandate or that tax penalty that when you don't have coverage will be a month-to-month kind of system.
Okay.
So if you had coverage for 6 months of the year and then the other 6 months you didn't have coverage, they're only going to charge you the penalty for those 6 months you didn't have coverage.
So it's going to be much like in probably January or February I start to get my W-2 statements or other statements from tax. So now I'm going to get another one from my insurance company.
Exactly, and that's my understanding of it, that they're going to be providing that material. And then another thing that I want to say is that in regards to the individual mandate, there are exemptions from people that either have a hardship, who really can't afford health coverage on top of all the kind of safety nets that are being produced from the Affordable Care Act, and then also just additional categories that are taken into consideration, for example, religious views on insurance and so on and so forth.
So if there's somebody out there who either feels like they really can't afford even the subsidized coverage level, and doesn't qualify for Medicaid or Medicare or some other kinds of programs, they could potentially not have insurance and not pay the penalty if they meet certain guidelines.
Yep.
When we talk about these financial supports, what are the levels of incomes that'll be where you might qualify for some support? Is it just very low income people, or is it so what's the range of folks who might expect to see some sort of subsidy?
Sure, and that's a great question. I know we talked a little bit about it, where the tax credit subsidies are really, guided for more of the middle class grouping of individuals, and the way they kind of justify that is the marketplace is open to those people that really didn't have access to coverage, and so we kind of understood that those who had really low incomes had the Medicaid program, and those who were able to afford out-of-pocket costs could just buy insurance, and then there's that middle gap of people that really couldn't get coverage in any way.
They weren't poor enough to get Medicaid, but they weren't wealthy enough to have a fully covered Cadillac plan through their employer.
Yeah, and so these tax credits will actually be available to families that are at 100% of the federal poverty level through 400% of the federal poverty level. And so they'll vary, and they'll be obviously put onto the different levels of plans, because there's going to be, and this is where it gets really complicated, but the different plans vary from bronze level plans where the insurance company is paying 60% of the cost and the family is paying 40% of the cost, to platinum plans where the insurance company is paying 90% of the cost and families are paying 10% of the cost. So that'll vary in terms of how much the premiums are and how much the out-of-pocket costs will be. But those tax credit subsidies will help reduce those premiums.
Okay. So we're starting to get a picture of how complicated this is going to be for consumers. You have income, you have smoker, non-smoker, family size, and now what level of plan and what coverage they might want. So if a family could choose a bronze, which is the lowest premiums probably, but the least coverage, or a platinum, which is probably the highest premiums, but
and it's not a fast and sure rule. There's going to be some flexibility where, depending on the level of coverage in terms of the benefits, a silver plan could be cheaper than a bronze plan on two different insurers.
Even more complexity.
Exactly. but for the most part, yes, you'll see lower premiums in the bronze plans compared to the higher premiums of the platinum plans.
So one of the things we're going to start talking to consumers about is just shop around, right?
Yeah.
Know the features of the plans, know the cost, understand what supports you might have available.
Exactly, and know, and one kind of caveat is all the plans are going to have a certain variety of benefits. These are the essential health benefits, and they actually cover, I believe it's 10 different categories of benefits, where each plan, inside the marketplace, outside the marketplace, these have to be covered. And so that's actually going to be one feature that'll help consumers know that, well, at least at the end of the day, if I pick any of these plans, I will have these
bare bones
benefits.
Right.
And that's something I would even say check out and see what those benefits are, so that you at least know those will always be present.
Right.
And it's those additional benefits that your family might need that will dictate where you really go.
Great. So as we think about families who maybe are on public assistance or they're receiving disability, how does the ACA affect them?
And our state is actually putting in a waiver to the federal government to adjust its eligibility criteria. One thing that I do want to say, though, is that the Badger Care Plus program, or our Medicaid program, for the elderly, blind, and disabled will not be changing. That's actually one of the programs that has no effect regarding the waiver that the state put in. Additionally, the criteria for pregnant women is also maintained. It's the same. And so it'll actually be the programs for adults, both parents and adults without dependent children, and then the program for children that will have some changes in eligibility. So to get into that, currently I should say, parents are eligible up to 200% of the federal poverty level if their children are also on Badger Care Plus.
So if the child's covered, basically the parent or guardian can also be covered.
Up to 200%.
Okay.
Yep. And that'll be changing starting January 1st to 100% of the federal poverty level, with the idea that parents above 100% of the federal poverty level will now be able to go into the marketplace.
Okay.
And then this is the state's way of then being able to pay for parents who do not have dependent children to be on the Badger Care Plus program up to 100% of the federal poverty level as well. Because beforehand we had this program called Badger Care Plus Core, and it opened, I believe it was like August of 2009, and was frozen October 2009. So we had 3 months where people were able to enroll, and then this waiting list started. And actually, I believe the most recent count is like 140,000 people on this waiting list.
So a lot of people who don't have kids, who qualify, who are sort of stuck.
Who have been stuck. And that program was up to 200% of the federal poverty level as well. But now, those adults will be eligible up to 100% starting in January 1st of the federal poverty level. And then the remaining would be able to go into the marketplace. So that waiting list will be over, it'll be non-existent, and all those individuals will at least have some path to coverage.
Right, and they'd probably be at those income levels, they'd probably be heavily subsidized with premium support.
Exactly.
Right. That's right.
And then for children, it's actually now up to 300% of the federal poverty level, whereas children before, or currently I should say, have been eligible regardless of income, as long as they did have access to their parents' employers' sponsored health insurance. So that's the change going forward from January 1st, is that children will only be eligible up to 300% of the federal poverty level.
Okay, so to wrap up, and fitting sort of as somebody who works in covering kids and thinking about kids and families and how this really affects kids specifically. For children who are in special situations, like with a foster parent or a grandparent, are they still eligible for these kinds of benefits?
Yeah, and actually that's actually one of the areas that the state has expanded its coverage for those children. So before, children were eligible regardless of income if they were entering out of the foster care program through their 21st birthday. But the state actually in its waiver has expanded that to the age of 26.
Oh, wow.
So children who are exiting the foster care program, but they're now young adults, will be eligible on Badger Care Plus through their 26th birthday. And then when they're 26, they could be assessed as an adult without dependent children, and if they're under 100%, still maintain that coverage, or maybe have to transfer to the marketplace. But that is an expansion in coverage relating to that population.
And so at this point, will most kids in the state be eligible for coverage, particularly low-income kids?
Yeah, I mean, that's one of the areas where I think Wisconsin's been very strong in compared to the rest of the country, where I believe our uninsured rate for children is around 5%.
And last, you just mentioned this age of 26, which has suddenly taken on a new meaning
Sure.
in the health insurance side, because if you have a child who's under age 26, they can be covered under your plan. What happens after 26, and should parents be moving their kids off of their plans or into the marketplace, or how should parents be?
Sure, and that's a good question, because one of the pieces of the law regarding young adults was the idea that just because you've gained this title of adult doesn't mean you're rolling in dollars and you can afford the same coverage that your parents have been able to at least accommodate while you've been in school. And so this way of expanding it to the age 26 has been a nice, essentially, safety net for young adults so that they can remain on their parents' coverage, but also in mind that some of their parents have been either on the Medicaid program or didn't have coverage, and so some of those adults still remain uninsured. But one thing to keep in mind of those who are either older than 26 or weren't being able to access coverage through their parents because they were uninsured themselves, will now have access to potentially the Badger Care Plus program if they're under 100% of the federal poverty level. They'll have access to the marketplace. And in the marketplace, there's also these plans called catastrophic plans. And those plans are low premium, high deductible plans. And what that means is the premiums are lower than traditional qualified health plans that'll be in the marketplace, with the purposeful target of kind of having this second option for young adults. So to qualify for a catastrophic plan, you do have to be 30 or younger or qualify for a hardship in terms of being able to pay for your premiums. And so this is actually something that those who are healthy or the perseverant, where they're kind of thinking, oh, I don't have to pay all this money for a monthly premium. It's an option for them because being on a catastrophic plan, you're going to have access to 3 primary care visits in a year, free of cost.
Okay.
And then also your preventative care will also be free. And then, yes, you would have to pay up to the deductible in order to kind of get into those essential health benefits that I mentioned earlier, but it's still an option for those, those individuals.
So for younger, under 30s, whether they're above or below the 26 age, these catastrophic plans might be a low-cost way to cover both basic primary care and preventative care, which hopefully keeps them from getting sick.
Exactly.
But also if some, accident or something else happens, they can potentially have some coverage once they meet that deductible level.
Yeah. And one thing that's also kind of important to think about is that those plans will count for the individual mandate. So even if a young adult is on a catastrophic plan, it qualifies as having enough coverage so that they don't have to be at risk for paying the tax penalty.
For paying penalty down the road.
Yep.
Great. Well, I think we've learned a lot about how complex this is going to be and how really this is another case of where we have to pay attention to what's going on in the marketplace, being good shoppers, being good consumers. So I want to thank Caroline for being here today. Caroline Gomez is the Healthcare Outreach Specialist and covering kids and families at UW-Madison. This has been a presentation of the UW Cooperative Extension Family Living Programs. There are more resources that will be available on this. We mentioned a couple. Are there any others that you want to mention before we end?
Well, I kind of want to re-emphasize healthcare.gov because that is going to be the federal facilitated marketplace where people are going to be able to access coverage. And like I said, it's a nice hub for information and resources, and especially when people are looking for a factual, consistent message, that's the place to go right now.
Great, and so we'll put those links on board with this presentation. Thank you again.
Thank you for having me.